So let us take up Sina from Dr. Nash Therapeutics on this day, 30 of May 2025. And I hope all the beginners or professionals, whoever are going back to old sources, they are not forgetting Nash Therapeutics, Leaders in Homeopathic Therapeutics by Dr. Nash. It is a very important book for all the beginners, all the senior practitioners. Keep going again and again to one of the books that you have read in your early years, and this is going to change your perspective towards the same remedy and the same book again and again each year as you go through it. Dr. Nash Therapeutics is one of the books which I keep going every year, and it's been last 17, 18 years. I must have read it almost 10 to 11 times. So Sina is the remedy that we'll discuss today. Dr. Nash tells us that this is a unique remedy only homeopaths know how to use. Now there is always a reason why he claims a sentence and puts it down in the way it should be. And everywhere in each remedy, he has given some wonderful correlations of all the remedies and their use of as an alkaloid by the old school at that time. How was Sina used? Dr. Nash tells that the old school firstly did not believe in the concept of worms. Secondly, they bungled with the alkaloid of Sina, which is santonin. And then they finally admitted that there is this presence of worms in many people, many children especially. So, by the time they could accept and digest this theory, we were already curing patients. That is the beautiful part. And Dr. Nash lays down some real good, genuine clinical pointers in his Leaders in Homeopathic Therapeutics by telling us that this is a wonderful remedy which we should not miss out. How will you recognize in your clinic? Let's go over Dr. Nash's therapeutics and find out. Sina, first thing he tells us that Sina is not the only remedy for worms or shouldn't be the remedy that should be thought only in worms. It can be a wormy child who is very restless at night, screams out sharply in sleep like Apis mellifica, and he is cross and ugly like Chamomilla, kicks and strikes the nurse or the attendant or the mother or the relative, wants to be carried like Chamomilla or wants to be rocked. There needs to be some active movement all the time. And it will be rapid changeability. That is what you need to observe. So, in all the symptomatology of SINA, you will see that there is rapid changeability, does not want to be touched, does not want to be looked at, antim-crude, desires things and refuses when offered. Bryonia and Staphysaci are one of the two remedies which are very close to this symptom. And also it cries if anyone takes hold. So it's like catch 22. You know what to do. If you lift the child, there is a problem. He needs some activity. Then he'll feel dissatisfied. He wants to be let down. He does not want to be touched. So it's a situation for a parent who cannot do anything more than what the child demands at that time, and yet the child is dissatisfied. It is a perfect picture of a wormy child as described by Dr. Nash. There is head, red, hot face, glowing redness of the cheeks, and pale, sickly face, and dark rings around the eyes. The red face with paleness around the mouth or the anus is one of the characteristics, and we cannot miss this in our clinical practice. So, Dr. Nash tells us that chamomilla has one side red and hot, and other side is pale and cold. And there is boring and pricking and grinding of the teeth when the patient is asleep. In fact, there is something which is additional symptom apart from the boring and picking of the teeth in sleep, and that is he jumps and jerks in sleep, and there is frequent swallowing as if something came up, and there is choking and coughing. Such a combination is not found in any other remedy than in Sina. So if you'll see someone who is having two sets of symptoms, okay, alternating hunger and no appetite. Few minutes ago he was asking for a lot of food, and then in the afternoon or in the evening he'll not eat any food. That rapid changeability or alternation is found in Sina more often than in other remedies. If you remember this, your job to prescribe Sina is very, very, very easy. So in sleep also you will see jumps and jerks, frequent swallowing as if something came up, and there is choking and coughing. Such a combination is not found in any other remedy. Whooping cough, jerking, trembling, twitching, convulsions are found and efficacious when worms are present. Case by Dr. Nash, he comes to an end of the remedy Sina, and he tells that one of the times he saw that the whole family was affected with typhoid fever and everyone was sick, including a 6-year-old child. Now he was wondering what he can do to save the child, and all the symptoms he found were matching to that of Sina. But he was skeptical to prescribe this remedy because the textbooks had not mentioned this remedy for typhoid. Now, this was a time when all the old school practitioners were converting to homeopathy, and they used to refer disease conditions and prescribe remedies just like they used to do in allopathy or the old school of medicine practice. So they were skeptical to prescribe remedies which were not mentioned for certain clinical conditions, but they would give it with a pinch of salt and a lot of worry that this will cause a change or not because it's given on symptom similarity, and they were slow in digesting the concept of homeopathy. Miraculously, Dr. Nash also cured this case of typhoid, which he mentions in his book Leaders in Homeopathic Therapeutics under the remedy Sina, where a 6-year-old child, along with the whole family, was affected with typhoid fever. It was rampant across Europe and US back in 1900s when there were epidemics, and the patient got cured. So, if you are struggling in your clinic with certain patients or certain remedies, you don't know how to prescribe, go over the cases of old authors, old practitioners, and certainly you will get the confidence that you need to practice and go further. That's a very short session from us today, Homeo Setu, and stay tuned because something interesting is coming for you all, and stay subscribed.